doing, what is this IBMS thing? That's my husband's goal. He wants to help people if he can, and then he wants to build a relationship with all other doctors and exchange the information. Guess what? I got my baby in Korea, and not even 1/3 of the price.
Global organization, a world body.
I'd like Dr. Banassi to come up and receive the Emerald Circle Award.
IBMS, like I said, was a pioneer in medical tourism. We're at the ground level right now. Medical tourism is taking off like a rocket ship. And I feel that this type of thing is just in the very primordial stages and will expand immensely, which is why I advise my colleagues, friends in the medical field to get involved.
Finest healthcare providers.
I just want to say congratulations on being an Emerald Circle physician of the International Board of Medicine Surgery, one of the finest healthcare providers.
To be here tonight. We are very honored to be a part of the IBMS, International Board of Medicine and Surgery, that is opening up the door to the entire world, to the finest medical facilities with the finest doctors.
It gives them a lot of comfort to know what they can do outside the country, and also a lot of people that might not be willing to do it just by reading or seeing it online, by having a live person see you and talk to you.
And at the meantime, we would have international meetings like.
It knows no borders. It's truly a global effort.
Contribution to the most needy among us. I'm going to let Dr. Sharma present this award.
So the patient safety and the best health care, these are the two small things we could give to the patients through IBM.
It comes from the heart. Dr. Sharma, famous in India for his international appeal, says it best: it's one human, one world, and now one healthcare.
Oh, it gives a lot of integrity to the physicians. Getting recognized at a large level, at an international level, at a global platform, at the world level, this is the biggest laurel for any doctor. We have got our regional conferences, we have our national conferences, we have got our local associations of the doctors, or we have the specialty associations. But there is not a single body of the qualified doctors around the globe which can represent, and here I feel the IBMS is the big organization filling the vacuum.
Us share credentials. It provides visibility and transparency for people seeking health care all over the world. It's global in its an impression. It's something that people need, they look for, and it is something that they will want for themselves as well as their friends and families.
The International Board of Medicine and Surgery, global continuing medical education.
Return to the soul. We can really go and train the physicians there and make them worthy to serve their country in remote areas, plus themselves, and advanced technology along with charitable work will really produce more of worthy, competent physicians to treat humanity. And I really feel if I have bread on my table, that's to say in medicine-wise, I really think I should share that with the whole world.
Presents Advanced Techniques, Complications of Robotic Surgery, a hands-on live workshop simulation taught by Dr. Sunita Sharon, gynecologic surgeon and Ruby certified faculty.
This great radiologist with his finer techniques, without knife, he goes to every corner of the body. I would say radiologists are going to replace
all the surgeons in the future. Dr.
Samuel Shuby, MD, Interventional Radiologist.
Global impact of information is greater than any other. I think that having credentialing at various levels is ideal to protect patient quality and patient outcomes across the world.
Register now at www.ibms.us/conferences.
I'm going to tell you tonight why we are different. The mission of Medical Tourism Associates is to help patients achieve first-class medical service at a reasonable cost. Currently, Tourism Associates are your personal medical concierge. We coordinate with you and your doctor, your hospitals. If you want to go early and just be a tour, we coordinate that with you too. We also coordinate with your recovery. We make it as stress-free as possible by providing, if you have to have surgery, you want to make sure that it's done with the best possible doctor.
It seems like it's very affordable, and I'm very happy to be here.
I think this is a great opportunity for many people to do a lot of things that they never thought they could afford. And it also shows that how viable it is and how realistic it is to be able to go to another country and get the same or better care than what they have here for much less.
3 cities tour while you're here, Tampa, Orlando, and West Palm. We feel like once Americans are exposed to doctors like yourselves and they see how well educated you are, how well spoken you are, how beautiful your clinics are, that really will answer a lot of questions for America, and it really will send a lot of people to other countries for medical treatment.
That Dr. Kalin has begun, and I think that it should have been embraced by all countries. I think there should be a certification process. I think that all countries will benefit from the economic impact upon their country. I think that they will improve their overall technology by getting certified, by having continuous medical education that will surpass what they can get in their own country.
So my husband, that's what he's doing. He's going all around the world and exchanging information with the doctors, get to know doctors.
Done with local anesthesia. There's really no downtime, no discomfort. People really get back to their quality of life immediately, and from there on are very active and see the benefits almost immediately. The procedure has been made very simple in the office. It's still a procedure that takes a lot of planning.
Well, IBMS really was a pioneer in medical tourism, and they're international, and we're expanding our patient care beyond the local area. We're from this part of Florida, but the practice could certainly benefit from patients from really all parts.
Known as the International Board of Medicine and Surgery, who have done their homework, have already gone there and found that this is a safe place to be, and have aided the design community in finding and creating the comfortable and very safe, secure facilities for these activities to take place.
They don't know why IBMS in their country. And I said, how? I am told you told.